Yes, good afternoon. And yes, Dr. Yaffe is not here today. She's on another meeting with our federal, provincial, territorial counterparts. And they're having discussions on some other issues of a pan-Canadian perspective in regard to COVID-19. So today we're going to look at, again, the numbers. We're going to be seeing that we're plateauing at a level right now. And I'll talk about that in a moment. And in light of some of the announcements we made, what does that mean as far as our public health measures and our way forward and the different steps and the reasons for taking some cautionary steps at this time and to continue to observe, do more testing, and to look at testing different groups in different ways to get assessment of the overall situation in a number of different settings and with different groups at that time. So let me do the numbers first in that regard. So again, we've had 413 new cases reported since yesterday. So that's up again. The total amount is 24,187 since the start in January. The distribution, male-female, is the same as it has been. The 42% are 60 years of age and over. And most of the cases, 63, nearly 64%, are in the Greater Toronto Area public health units in that distribution, most along the lines of the Toronto, Peel, and York region. The number of deaths, unfortunately, continues to accrue in that light there, and we've seen some more at this time. So far, a total of 1,993 deaths. That's an increase of 31 from the previous report. The healthcare numbers continue to accrue. We've had an additional 67 since yesterday's report, and the number in hospital has increased by 3, while those in ICU have stayed the same in that result. Ontario's recovering, again, that continues to grow, 18,509, so that's 77% of our cases have resolved. As far as the hospital version is concerned, there's 984 people with COVID-19 in hospital. That's a decrease of -7. The number of people in ICU is 155, a decrease of 5. And those in ICU on a ventilator is 117, a decrease of 3. In the long-term care perspective there, we have 216 active outbreaks, 287 cumulative since the start. This is in the IFAS data, by the way. And 4,656 confirmed cases in residents, and that's cumulative, and 1,601 confirmed cases in staff, and again, that's cumulative. The number of deaths have gone up by, my number here is the number of deaths is up by 25, and the number of deaths in healthcare workers was increased by 1, unfortunately, and I believe that was in the Ottawa area, and condolences to the family in that regard. Respective retirement homes, 64 are in outbreak, and 184 deaths thus far. It's an increase of 3. So in that light there, we have done testing now, a total of 577,682. And the total tests completed in the previous day were back up to 10,506, with 5,000 pending, or over 5,000 pending, to be processed through at this time. So, as I said, over the last number of days, with our data here going basically 427, 390, 413, with data variation, we're pretty well at a plateau, whereas we would hope to keep coming down in that regard, in that light. So, well, that is disappointing, and we're trying to get a sense of why is that accruing. We have asked some of our health units around, especially those that get the majority of the positive cases, such as Toronto, and their answer was that some of those 413, and quite a few number, are still residual ones from the long-term care survey coming forward, because the test done yesterday came in the day or before. They were collected a day or two before that, and some have even earlier, because by the time they get all through that process and entered IFAS, it may be 4 or 5 days. So basically at the end of last week's comprehensive survey of all staff and residents. So let's see if that does evidence out over the next few days and we see a greater shift over to more of the community. I don't have the breakdown today of the actual community versus long-term care outbreak contact tracing ones. I would guess it's the same proportion as it has been thus far, but I haven't got that number to share with you today, as we did not receive that at this time. So with that in mind, In stage one of phase two, what we have done is, while we, in a sense, people talk about opening up the economy, that means, as the Premier and the Minister of Finance and others have announced, a greater variety of retail facilities that are open for the public, curbside, sometimes in the center with distancing of patrons coming in. Some are required to wear facial covering, as we've asked people to now, as compared in the past, where we were, it's because the 6-foot distancing was there and there's very little out in the public. Now there's more in the public. We have asked for the facial covering. In case you want to know, I wore my mask up today to come to the press conference in that light there. And so that we've had more social constraints in that way, because we're still seeing, especially in the Greater Toronto area, a fair amount of disease activity, as noted by our daily numbers. At the same time, we said when you're out, it's still the 6-foot distancing, whether you have a mask on or not. So just because I wore one doesn't mean I was just casually gathering with people. I was trying to keep away from everyone by 6 feet. Why? Out of respect for them. And not that I was fearful of them per se about their infection, but I'm doing it as we do in Canada and Ontario. It's one of mutual respect. That's why we wear the mask, and that's why we do the physical distancing, as discussed by Dr. Theresa Tam in the last day or two with our federal, provincial, territorial counterparts. So while we've opened up the economy, we have not relaxed the social constraints. That means the social gathering numbers, and even with the aspects you've been asking us about, with the concepts of other provinces with the bubbling and the cohorting, we're still working that through to see if we were going to do something in Ontario, how might, could, and should we do that, and what should it look like. So these are important things to consider, because remember, stage one of phase two is a 3 to 4 week period as we observe what we're going to do. So some things will be staying in place as we hope to see the drop in these numbers, and with enhanced testing in many areas, to do with some even further case contact management and containment to any cases out there. If there are clusters or outbreaks, that's different than community-wide. So that's the perspective we're at today. And with that, I'm going to hand it over for media for questions.
Okay, we'll go to the phone line for questions.
Your first question comes from Lisa Zing with CBC News. Please go ahead.
Hi there, Doctor. As you said, we've seen the number of cases go up in the last few days. The health minister said it's not indicative of what's been going on in terms of the effect of the opening, and you mentioned, long-term care numbers as well. But just generally speaking, considering it seems like we still don't have a really good picture of what's going on right now, do you think, in your opinion, did we open up too fast, too soon?
So as I said, one thing is to open up the economy. The other is, are we relaxing the social public health measures? And as of this date, we have not. We have still asked people to stay at home. If you need to go out, keep the 6-foot distancing. If you think you're going to be in an area where your distancing may perhaps be compromised or could be compromised, then wear a non-medical cloth mask in that regard. So we've added that on. If anything, we've had more constraints socially than we had before, and we have at this time in phase 2, stage 1, have announced no other social relaxations at this time. And as you heard, the Minister of Education announce that school would not be opening. So a lot of those social gathering ones have remained constrained, while a number of the economic side, that means business and retailers, have been allowed, or permitted, if you may, to open if they adhere to the standards of the 6-foot distancing, limited patrons in the facility, curbside ordering, all the above, with proper protection of their employees, including plexiglass shields for cashiers, and the use of facial coverings for staff in those settings. So economic in one way opening, social, public, not yet.
Thanks very much. But what I'm hearing from some experts are even saying, they're saying that the economic measures so far are a little too much. Do you think that's the case?
I think some are assuming that if you open up those economics, will the patrons, will the public, will the retailers be adherent to the standards? And that's always a good question. We're only in a few days into it. We have to assess to see whether there is good adherence, what I've heard and seen so far would seem to indicate that's the case. So I think the assertion that by opening up, and if you allow a store and then they just throw everything and become casual with the whole event, is what they're, I think, fearful of in that, and the more people out on the street, if you may, or around. Those are all good reasons for watching and asking for extra caution. And so we haven't quickly moved to relaxing our social measures at this time. So I think while it's something of concern and something we're watching, I have not seen evidence of that as of this time, but we're in just the first few days of stage 1.
Next question.
Your next question comes from Antonella Artuso with the Toronto Sun. Please go ahead.
Thank you. Hello, Dr. Williams. I wanted to ask, there are reports that members of the military have tested positive for COVID-19, and I was wondering what your sense is of what's happening in long-term care, that even people sent in to help are becoming infected.
I haven't received the full report from the so-called long-term care IMS table. I have been aware that some have been tested. Some of the Canadian Armed Forces staff who were working in facilities have tested positive. And we haven't got the full report back from their commanding officers yet in that regard. So I think for me to make a comment on what happened in that situation would be premature until a full report and review is undertaken by the Armed Forces in that regard, advising back to our long-term care incident management system table under Dr. Kevin Smith. So I have not received a report further on that, but I was aware that there had been some positive tests. So it requires, I would think, only necessary an investigation and some analysis and comments back from the commanding officers and as well as from our IMS table. But I have not received that report at this time.
Follow-up?
Thank you. Today, a reporter asked Health Minister Christine Elliott about contact tracing. She said that you are meeting the target that you set for that. I wanted to ask, as the Premier talks about expanding testing well beyond what the number of people that are being tested now and possibly even random testing, do you think public health has the resources to do effective contact tracing, especially when you consider that there is no reported source for, I think, about 1/3 of the COVID-19 patients in Ontario?
So that's a good question. We have our table looking at that as well. So you've asked about 3 or 4 questions in one. So our case contact management, a lot of the health units out in the outer area that are getting anywhere from 0 to 5 or 6 cases a day really feel they have no problem with the case contact management in that regard from the load. If you're talking about the central ones, especially where Toronto, we may get up to 180 to over 200 in one day, is a lot of work to do and to cover down that. They do have the staff size on that, and we made available that if they need any more resources provincially, we would certainly move alongside to assist in that regard. So looking at the functionality, the integrity, the quality of the case contact management is one of our priorities, and we continue to work with our medical officers of health and their staff throughout the province, and especially those that are in the GTHA that have more of the caseload on a daily basis than some of the outer ones, with a few exception ones on some of the border crossing areas in that regard. So that's the first part. And the sense is that how many have a case contact management one there, and we're trying to get those numbers down so that when you ask people to say, you know, where did you get it? Obviously, I assume they didn't travel. There's still some travel occurring in there, not a large amount. And did you get it from a known case? And a lot of them have been identified as we put those in those numbers there along with the outbreak numbers. Some are from a workplace setting. We're seeing a few more of that where public health is investigating workplace cases and outbreaks. Some are from congregate settings in that kind of regard. So there's a variety in there, but there's some where the people said, well, I can't recall. And in that way, it concerns us that the people, well, if you were maintaining your proper social distancing, physical distancing for the last 3 weeks, you got it from somewhere. And I think either people have forgotten or they're reluctant to admit that they were probably in breach of that type of arrangement and were in some contact. while that may be what they don't want to tell us, it's really important they did, because then we know if they're in a group of 10 that went and had some gathering unconnected, we need to contact those other 9, because now they are now potential cases because they've been exposed. So it's one thing to keep that information yourself. It's another thing to share it. If those are really true friends and you've worked with, you want to make sure that they are going to be alerted so they don't spread it to their family and other members and second and third wave and so forth. So we're still trying to drive that one and get our EpiLink cases really down. That's a term, sorry to use the jargon. The cases connected that are not out there saying we don't know where they got it from. We want to know where all of them got it from, and we're lowering that number as we speak. What the minister said is that how many people the cases were contacted within 24 hours. We wanted over 90%. We have achieved that, and our number of the cases coming down with the contact and management is coming down as well. So that's moving all in the right direction. And the third and fourth question dealt with testing. The testing capacity is really important for us in public health as we do the case contact management, because you want to go out quickly. And if you find a case in a, say, a work situation where there's 50, 200, 300 employees, you want to go quickly out and test all those 300 employees. So you've got to do that one. If you have 4 or 5 places of outbreaks, you've got to test them all. And so the more things that open up and deal with that, the more outbreak management you're going to have to do, including if you have an outbreak in a retirement home, they are and will be testing all the residents and staff in the facility. If there's a long-term care home that is in now resolution for a week or 2, and there's another case, an outbreak, we'll have to go back and test all those staff and residents all over again because it is a new outbreak. And so that outbreak management has to happen in there. So positive cases are followed, their contacts are tested, and sometimes the contacts of those contacts have to be tested. So that's one part of the testing. Then there's other testing where you're doing larger surveys, much like we did with long-term care, and that's of interest to do some of those as well to inform us those sectors. And now with more and more people going back to work, there's an interest to say, can we do some testing of those individuals as they go back to be persuaded that in the work situation, everybody went back to work was negative, at least at that time. And knowing when you're negative at that moment. Assuming you have done your social distancing, physical distancing, the chance of you of contracting and incubating should be 0. But if you have not been, you could be negative that moment and positive a day or 2 later. So we hope the two go together, the negative test and the fact that you have up to that time and will continue to maintain your distancing and work in the workplace with the proper distancing, with the proper facial covering, et cetera, et cetera. So there's a lot of ifs in there. And we need everybody to stay at the task in our new COVID reality. So I think I covered most of your questions in that one.
Next question.
Your next question comes from Natasha McDonald with Radio Canada. Please go ahead.
Hi. The Premier said that he wanted to test daycare staff as well as teachers whenever schools reopen, but he ruled out kids. So I was wondering why that was.
With teachers, that's of course a question for later in the summer, and that's a number of stages down the road. We'll have to see where that's at, but we're in constant communication with the Ministry of Education. There's another meeting today, and about strategies and things with daycares, childcare, with summer school sessions, and with potential of ideas around fall. And we haven't got any conclusions on that perspective yet. On the child care centers, as you know, we have been testing all the staff that have been opened up the essential services daycares for staff. And so we've pretty well completed all that testing and waiting to see if there's any positives beyond. We had the one outbreak that was specifically handled and see if there's any others. As far as going forward and open up as all the rest do, we're not opposed to testing staff going back, and so that's one that we're still trying to set that up because as of yet they haven't opened up. But again, we've been in consultation with the Ministry of Education and with the Minister of Education in that regard, and we want to do that kind of aspect, whatever is best seen as being necessary to ensure that parents are satisfied of the safety of the children. Now, on the children, our testing in children in general, as you know, nationally and internationally, the incidence of COVID is very low in children. We're looking at some other data sources. We know that, for example, the Hospital for Sick Children is testing all children coming in for procedures. And while they have seen some, I believe, in their outpatient, because some were seen with suspected symptoms, I believe the number is, besides 2 cases that came in before, was last time I heard was 0. So it's a very low incidence in that regard. And testing children requires, definitely parental consent and presence, in my mind, as well as the proper staff that can undergo or undertake doing nasopharyngeal swabs on infants and young children. So we want to make sure, if we are going to do that, we want to do it in a careful way, effective way, a quality way, with full consent, and in such a way that it was conducive to the mental health and well-being of the child. So those are a lot of things to put in place before you just go ahead and start doing children. Where we've had outbreaks, it's a different story. And we did some testing on children at that time, and so that was required because there was an outbreak and there's a possibility of infection in the children as well. So different settings as compared to routine monitoring.
Follow-up?
On testing, when reporters asked the Premier, why Ontario was missing its targets this week, he blamed low attendance at assessment centres. But this morning, Prime Minister Trudeau was talking about logistical and financial limitations, and about how the federal government is going to step in and help Ontario and Quebec to ramp up testing. So can you give more clarity as to what those logistical financial limitations are for Ontario's case, at least?
I must admit I didn't hear the Prime Minister's commentary on that. So I really can't comment in there. Besides, all the time we depend on our federal counterparts with ongoing supply of swabs, ongoing supply of reagents. That's an ongoing discussion with PPE and different things. So whether that fits in that category, but again, I am not privy to know I didn't hear what the Prime Minister said and how our Premier has commented or dealt with that comment. So I'd be premature for me to comment on that.
Next question.
Your next question comes from Randy Rath with CHCH-TV. Please go ahead.
Hi, Doctor. We're seeing cases of people wearing face shields without a face mask in some circumstances. Is a face shield alone enough to supply protection for other people and yourself?
Yeah, I've seen that too. And, there's face shield and face shield and face shield. So there's lots of different varieties. And there's some that sit quite close and there's some that sit out on funny angles. As far as any standardization, we have had no recommendations from our FPT counterparts. We know that in our medical group, where they're using a surgical mask combined with eye protection, there's standards set in that regard. As far as public use, I'd be interested to know what the relative comparison of protection is, knowing the cloth facial covering, again, of your capacity to impact other people. There's a reduction of a small percentage. So again, it's not the same as a surgical mask or an N95 protecting you per se, it's you to protect them. If you take the idea of the face shield, if it's down far enough from you talking, coughing a bit, like putting your hand over your elbow over your face, it does protect that to some extent. It doesn't mean things can't fall down below and land on materials and stuff like that. So I have seen more people with the cloth mask and a face shield both ways, which I think is an interesting idea or coverage. I know I'm going to be asking our federal counterparts, what do you recommend about the public use of face shields? What are quality face shields, what aren't? And as compared to those, they say, are retailers are wearing it in their job functionality, along with other types of facial coverings in there. So I'd like to see some more data on that before I was making some broad conclusion. Intuitively, it makes some sense, but I'm not sure how it compares to a facial, non-medical cloth face covering or mask in that regard. So I'm going to have to weigh that for the scientists and others to give a comment on if they can.
Follow up?
Would a cloth mask provide protection for a person from COVID. Could you compare that to an N95 mask or a surgical mask? And if a cloth mask isn't providing protection for an individual, should not people at risk, people over 60, compromised immune system types, when they're out in public, should they not be wearing a medical surgical mask, or wouldn't that provide them more protection?
So there's no doubt that a surgical mask and a N95 in particular, a respirator, gives far more protection than a cloth facial covering. What you're asking about there is, especially with N95s, is very much as critical as the fit testing, because there's many different versions of it. So it actually has to make a total seal around your face, and that means you have to wear it quite tight. And there is a slight part to breathe through, but those who wear them properly. It's not that comfortable for people moving around, especially those that might have some respiratory difficulty in there. So we are not recommending N95s and surgical masks for the general public. One reason is that in our conservation of personal protective equipment, we want to make sure that our healthcare workers and our other healthcare staff throughout the facilities, especially hospital, acute care, and long-term care, and other ones, and now new ancillary, including our primary care physicians, we want to keep that kind of provision for them, not for public consumption and wearing and throwing them in the garbage and that. So we're not encouraging that use by the general public. At the same time, there's sometimes some facial cloth coverings. We'd still say for those over 60 with conditions, their first target is, one, try and stay home if you can. Second, if you do go out, keep the 6-foot distance. Those are more effective than the mask anytime. And if you do, then wear one, because some can be not a little piece of cloth, but a proper one that is done up properly, not just hanging down the front of your face, as I've seen some people doing. So it's a combination of having it, but it's more important wearing it properly. And it doesn't mean that you can negate the need for the physical distancing. That's the clear message, that there's some people wear it and they feel they can be cavalier. That is not our message in the public setting. So it's not what you have only, but it's what you do with it and how you wear it is critically important. And some people tend to forget that, and you see it hanging down and it's not put on properly, and people are standing, talking to people really close. Again, that's not what we're recommending. We want that as an adjunct to the other measures, and you have to do it right, do it again, do it consistently.
Okay, we'll move to our last reporter.
Your final question comes from Camille Karamali with Global News. Please go ahead.
Hi, thanks so much for taking my question. So, yesterday, Minister Elliott, there's been a lot of blame on the provincial government for not meeting the testing quota of 16,000 tests per day, but it seemed like Minister Elliott was putting the blame right back on the public, saying that not enough people have been going to assessment centers. And just anecdotal conversations and evidence just shows that people either don't know that there's a wider array of symptoms that allow you to get tested now, or think that they might get turned away if it's not serious enough. Are you seeing the same thing, Dr. Williams?
I think it's a good point, because what we're looking at there, we want to know if we have opened up the assessment centers in that way, are all the system things in place that make the public aware, make the public know how to, and how to access those services. So we're working at that very carefully, even looking at, say, our self-assessment tool. Do we need to have that in place at the same level, or is that more information on what is COVID-19? And then if you think you have concerns, what are the locations of the assessment centers that you could choose to go to in a location near you, and how would you contact to make an appointment at those assessment centers so that you're not there riding with 200 other people. So we don't want that kind of situation at our assessment centers in that. So I think you raise a good point. Are the public aware? Does the public know how to do it? Are some of our messaging not clear? Is some of our messaging confusing? So we have to make sure it's consistent, and because there's many different parts and pieces to it, there can be some times where that consistent messaging does not get put through, and different members of the public run into some obstruction and saying, I thought you said and this said. So we're really trying to address that as assertively as you can so that the public are informed that they do have any symptoms, as the Premier said, of COVID, the wide range of new symptoms, that we want you to be able to go and get assessed and to be able to access that in the right time and the right way. And, and again, giving you the right information so you can contact to find out if there's already a big lineup. Then you say, okay, if you can wait for an hour, call back again. And we're trying to put that system in place so you're not left waiting for prolonged periods of time, especially in a crowded situation, which would be contrary to our messaging. So we're trying to address that. And as we said, we opened up on the weekend. We didn't get a lot coming out, perhaps a long weekend, but perhaps our messaging and our communication wasn't as clear as it should be, and we're working on that right now.
Follow up?
Yeah, and sorry, how do you work on that? I mean, I just heard that you are working on it, and you posed some of the questions yourself, but how do you answer those questions in terms of how to make that messaging clear and get that out there? And there's also just some people we interviewed who said, you know, they fear going in for more minor symptoms because they feel like there's a larger fear of getting COVID in going to some of those epicenters or hotbeds where the testing's happening, that there's this fear that they could catch COVID even if they don't have it, if they go in for something minor to get tested. What can you do in terms of reassuring the public on that?
So, well, part of it is speaking to the media right today. Second, if our self-assessment tool messaging, our telehealth messaging has to be consistent, we have to review and put those in place. I agree if people feel they have a concern. I don't think they need to have a concern. That's why I'm saying they should call the assessment center ahead of time because they don't want to be in a crowd. They may find out if you come between this hour and this hour, it's really fairly quiet. And so come on and or no, it's pretty busy right at the moment. Why don't you wait and call us back in a couple of hours and we can see you then. So I think there's a number of ways that they can do it, and they can ask their questions. Should I be fearful? They'll probably reassure them, no, our staff are fully trained. We have proper PPE on. The chance of picking up COVID while you're at our assessment center is zero. And so therefore, but they need to have those questions answered by the staff and the trained staff at the assessment center. And so there's a number of ways we can do it. We can do some more media, some information to get the message out to the public in a way so that those with any symptoms of COVID-19 and concerns that they've been in contact could get seen and tested and assessed, as well as have their questions answered.
Thank you.